Hello, everybody. We are going to start. Thank you for being here today. I'm really excited about this webinar because we have the honor to have with us Dr. Jane Greenblatt. And Dr. Jane Greenblatt is a pioneer in the field of integrative medicine. After receiving his medical degree and completing his psychiatry residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. He currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Massachusetts, and serves as an assistant clinical professor of psychiatry at Tufts University School of Medicine and Dartmouth College Hazel School of Medicine. Dr. Greenblatt has lectured internationally on the scientific evidence for nutritional interventions in psychiatry and mental illness. He is the author of 7 books, including Finally Focused, The Breakthrough Natural Treatment Plan for Hdhc. He's the founder of Psychiatry Redefined, an educational platform dedicated to the transformation of psychiatry, which offers online courses, webinars, and fellowships for professionals about functional and integrative medicine for mental illness. Quiero presentarles al Dr. James Greenblatt. Es realmente un honor tenerlo con nosotros hoy. El doctor es un pionero en el área de la medicina integrativa y después de recibir su diploma médico y completar su residencia psiquiátrica en la Universidad George Washington, el doctor Greenblatt completó su especialidad en psiquiatría en niños y adolescentes en la Escuela de Medicina Johns Hopkins. Actualmente, él es el jefe médico del centro de Walden Behavioral Care, que se encuentra en Waltham, Massachusetts, y también es un profesor asistente de psiquiatría de la Tufts University School of Medicine en Dartmouth College Hazel School of Medicine. Él ha sido exponente internacional sobre lo que es la evidencia científica para las intervenciones nutricionales en el área de la psiquiatría y de las enfermedades mentales. Es autor de 7 libros en los que se incluyen Finalmente Enfocado, que es un abordaje natural para el tratamiento del déficit atencional con hiperactividad. Él es el fundador de un programa, de una plataforma educativa que se llama Psychiatry Redefined, que se dedica a la transformación de la psiquiatría y que ofrece cursos en línea, webinars y también algunas especialidades para profesionales acerca de medicina funcional e integrativa en el área mental. So, thank you, Dr. Greenblatt. And just please, we are going to use the chat for the translation of this webinar because we are going to translate to Spanish the webinar on the chat. So please only use the QA to ask your questions, please. And thank you, Dr. Greenblatt, for accepting my invitation and for being here with us and everything. Thank you.
No, you're welcome. Very glad to join you this evening. And as you heard, I had very traditional training in psychiatry. I actually had the pleasure and privilege of being in Costa Rica in 2017 to give a day-long presentation with Dr. Mariela Podolsky on eating disorders. So a very traditional training, but for 35 years, I've been interested in integrative and functional medicine. And the last, oh, I'm sorry, I'm on mute. Can you hear me now? So thank you for the invitation. I'm very happy to be here. I had the pleasure of being in Costa Rica in 2017 with Dr. Mariela Podolsky giving a day-long seminar on eating disorders. And I've been practicing medicine for almost 35 years, and I've always been teaching colleagues about integrative and functional medicine. And 5 years ago, we started this kind of online platform to train physicians and clinicians about functional medicine and integrative medicine. And I think I wanted to start by just sharing, important differences between what I'm referring to as functional medicine and integrative medicine. And, we need both. But the functional medicine approach, which I've been trying to educate clinicians on, looks at the underlying biochemistry, looks at root causes, whether we're talking about schizophrenia or ADHD or depression. Our traditional psychiatric model is we're not looking at blood work or lab work. We're not looking at the gut. We're not looking at genetic testing. So functional is looking at the underlying cause, and the integrative is really the diet, lifestyle, mindfulness, spirituality, and all the kind of lifestyle factors that contribute to a holistic treatment of patients. And in the States, the integrative medicine in psychiatry has taken off. There are mindfulness programs in academic medical centers, but I really feel that there's been a tremendous neglect of the functional medicine approach to mental illness, and that's what I've been focusing kind of my career on. And again, we need both. And when I came out as a child psychiatrist in 1990, mostly treating ADHD, I had some parents who wanted a medicine for their child right away because they needed help with the behavior. And I had parents who, no matter what the how bad the child is suffering, refused and didn't want medications. And it was this kind of dilemma that got me situated early on as specializing in ADHD and setting up ADHD clinic to help parents initially kind of understand the role of medicines, and I think there is, but more importantly, the role of nutrition. And if we had to think of one word, I'm bored. Our ADHD kids, it has nothing to do with intelligence or ability. It's a performance disorder. It's a disorder of oftentimes kind of lack of motivation. And quickly, when we go through the history, it's clear that we had no idea what this disorder was. Every 10, 20 years, we changed the name. And from brain damage to minimal brain damage to separating out inattention and hyperactivity. But I do believe now that ADHD is a diagnosis that we understand. It's a neurobiological disorder. It's not a behavior disorder. It's not a disorder of willful overactivity and impulsivity and inattention. I think the medical field is quite convinced it's a genetic vulnerability, but a neurobiological disorder, which means the treatment has to have a neurobiological approach. Okay, and that's where we look at underlying causes with nutrition, and we also can look at medications. But part of the reason why we wrote the book about a nutritional approach is because the use of medications are just skyrocketing here. It continues to increase, and medicines are now approved in the States for children at ages 4 to 6 years of age. I've never prescribed a stimulant to a child that young. So medicine is increasing, and people don't have other tools. And the reason why it's so important that we understand the disorder is because if we don't treat ADHD, if we don't treat this biological disorder, they're debilitating, lifelong circumstances. And these symptoms that we see all the time that are very well articulated in the research, those individuals with ADHD symptoms that aren't treated have poor academic achievement, low self-esteem, stressful families, poor relationships, higher rates of divorce, increased criminal activity, sexual behaviors associated with obesity and binge eating, occupational stress, poor job performance. The list is pretty endless. And I think if you know an adult with ADHD who's untreated, you can appreciate some of these kind of symptoms that negatively impact someone's life. So we can't let somebody suffer if they are struggling with ADHD. So we need to be able to treat it. This is really, one of the more dramatic is the driving. Young drivers with ADHD that are untreated 2 to 4 times as many motor vehicle accidents, and the risk of totaling a car, as you see in this picture, exceeds that of being legally drunk. I mean, think about it for a minute. Impulsive, inattentive, young adult with ADHD is clearly somebody who is potentially dangerous on the road. So the model that we used in our kind of book on ADHD called Finally Focused, it was written for parents. We do have courses for professionals and fellowships for professionals, but the book, we tried to simplify it because I think in the integrative medicine world, consumers are really driving demand. So as a consumer book, we kind of use this plus minus plan and said that there is some things that individuals need more of, and we would determine that by testing. Could be a vitamin, a mineral, essential fatty acids, amino acids, could be a hormone, thyroid, it could be light, could be affection and love. There's positive research on being in nature affecting intention, and certainly positive feedback, because we know negative feedback is detrimental. And then what do they need to avoid? And here we talk about both toxins, food allergies, celiac disease, heavy metals, lead and copper, all are things that we need to avoid. And that's kind of the model. Obviously going to not talk about all of these. We're going to talk about a few today. We're going to talk about lead, copper, and these phytochemicals called OPCs. But first, even before I was in medical school in 1977, I spent a month in the office of this doctor here, Dr. Marshall Mandel in Connecticut, as a just an intern. I was interested in allergies, and he kind of followed the work of Doris Rapp, looking at food allergies affecting behavior. And in his office, he used a sublingual food allergy testing. They were clear liquids. Individuals, the kids, the parents, nobody knew what the liquids were they were getting on the tongue, but they monitored their behavior and their reading and writing and other skills. And I will never forget, again, I was a college student. I had no idea about mental health. I had no idea I was going to be a child psychiatrist. But I watched a child who was given these drops under his tongue. It happened to be peanuts, and he got agitated. He got angry. He could not do simple math problems, and his writing was very distorted. And this is a child who's had behavior problems at school, and he eats peanut butter every day for dinner, for lunch and dinner, because it was one of the few foods he ate. And these allergies did affect the symptoms. And when we talk about food allergies for ADHD, we're not talking about the typical IgE, those immediate hypersensitivity reactions that causes hives and might cause wheezing and might cause actually anaphylaxis. The IgG is called the delayed food sensitivity. And these can result in behavior problems. And you see some of the symptoms here. Kids that talk a lot, inattentive, short attention span, excitable, moody. And there are physical symptoms of these food allergies. Often we see the red cheeks and the red earlobes. This is common within a couple hours of eating the foods. In young children, it's eczema and colic, and not uncommon. And then the black circles under the eyes, the runny nose, the bad breath, and foot odors. Again, IgG delayed hypersensitivity to food allergies, and these are common, poorly understood by the traditional psychiatric community. I find these very important in young children under 12, certainly under 6. That's why I've never used medications in children under 6. We look for the underlying cause. You know, food allergies are one of them. Okay. The other, I don't know if you've heard of the Feingold Diet, but this was big in the 70s and 80s in the United States. People that were concerned about artificial food colors and dyes. And they did a number of studies in the 70s and 80s, mainly due to parental pressure. And guess what? They found that the dyes in foods did not affect children in these early studies, because what they did is they took 100 kids or 1,000 kids, and they did a double-blind, placebo-controlled trial, and statistically, kids do not react more to the synthetic dyes in foods. But I certainly remember vividly a child drinking Hawaiian punch in my office in the early 1990s and getting extremely hyperactive and running around the room. And what happened 20 years later, they started looking more carefully, and they did find that no, not every child is reactive to these synthetic food additives and food dyes, but there was a percentage of kids that were, and 8 to 10% is the estimate. And what they were able to discover is that these individuals had different kind of genetic polymorphisms in terms of how they break down histamine. So with the certain genetic polymorphism of this gene, HNMT, there's stronger behavioral reactions to artificial food colors. So, like everything else in integrative functional medicine, we need to do testing, and there's tremendous individual variation. I shared with you food allergies can affect some kids, and I also share with you these food additives and food dyes. They don't affect everyone. They affect a small subset. I think 10% is the easiest number, which means it's certainly appropriate for parents to try to eliminate these artificial colors and dyes. And I typically would say for 30 to 60 days. If they don't notice a difference in their child, they probably can go back. So what I want to talk about, I don't know if you people are familiar with neurofeedback, but it is a treatment for ADHD. And I'm not going to talk much about neurofeedback, but some of the theory, which I think is really important. We have all these different brain waves, and the important ones for us is the theta waves, which are the brain waves that have to do with the slow brain waves that are higher if we're not paying attention. So theta waves are elevated if we're not paying attention. And the beta waves, these very short beta waves that you see on the bottom, those are the brain waves that we use to pay attention. So in ADHD kids, we've known for a long time, since the 1990s, there's a difference in the slow wave, the theta wave activity versus the beta wave activity. Let me see if I can draw this. Okay, so the theta waves are increased in ADHD, and our beta waves are decreased. And so we have this ratio, this increased theta to beta ratio. And we can test these kids and we can see, and it's very diagnostic of ADHD. Okay, so I need you to remember that the ADHD kids have high theta. Makes sense because they're not paying attention. So neurofeedback is actually a biofeedback program teaching these kids how to lower the theta waves, right? Decrease theta and increase beta. And that's what they're training the brain to do. They're great programs. They're fun. They're engaging. Kids can, look at the computer, and when their theta wave goes down, they get a little ding or beep or a reward, and they kind of train their brain how to do it. It's long, it's expensive, and sometimes it's 20 to 40 sessions. But the Academy of Pediatrics, level 1, there is research, highest level of support for treating ADHD. So it can be helpful. And there are a number of studies. This is just one, 91 kids, average age 10.5. Neurofeedback worked as effective as the medication here, the methylphenidate, 20 to 60 milligrams. Okay, neurofeedback was as effective as the medication. And then here's another couple of studies looking at 104 kids, neurofeedback compared to the stimulant medication. And the neurofeedback kids had quicker and greater improvements, and it remained at the 6-month follow-up. So when these kids were able to train their brain, it kind of set, and they were able to, again, decrease. Let's go over it again. The ADHD brain is high theta waves, so the neurofeedback, right, causes decrease and increase, right? So the neurofeedback. So in my practice, we did this for a few years, but again, it was expensive, and I couldn't predict which kids would get better. So it was hard for me to ask parents to pay for it if I wasn't consistent. And so I started, since I was doing EEGs in the office, I started looking at these phytochemicals from plants and foods. And these are the blue and blueberries and the grape seeds and the chocolate and the pine bark. And these are classic chemicals called OPCs, oligomeric proanthocyanidins. And this is a type of polyphenol, a flavanol that gives these plants these very rich colors. And they have very, very significant kind of what I would call nutraceutical effects in the brain. And the research is quite extensive. Blueberries, grapes, green tea, all have profound effects on cognitive function. And I've been looking at this since 1993. So what I want to share with you is some of the work that we did using these chemicals, these phytochemicals, as supplements. And if you remember, right, theta wave, right, is the daydreaming brainwave. So these were elevated. And this is a kid with ADHD. So if you see the theta waves are all high here, except for this child, when these are different tasks, he was an auditory reader listening. He was able to pay attention. But baseline or reading, he couldn't pay attention. His theta waves went up. So then we gave him this extract of blueberries, grapeseed, and look at the difference. Theta waves went down. Okay, using extract of OPCs, theta waves went down. This is a 13-year-old boy. You can see this was the original in the 1999 or something, and pretty dramatic. Again, the high theta wave. We gave him OPCs, and it goes down, and pretty dramatic, significant improvement. So what I was able to demonstrate for myself, since we were doing these EEGs and we could measure the theta waves and the beta waves, is that we knew the theta beta ratio was shown to be predictive of ADHD. And we knew that if we could improve that ratio, that the kids function better. And neurofeedback did that, very expensive over 3 or 4 months. But we also find that these phytochemicals, OPCs, also decreased theta waves and improved that ratio. So, this was, really important. We used OPCs in children and adults. And the original research was mostly on pine bark. Pycnogenol is the name. And then, people got interested in looking at red wine, grapeseed. This was a study, double blind. These were adults, elderly adults, looking at these blueberry extracts for 12 weeks with improvement in cognitive function, as well as here you see here, improvement in brain activity on the MRI scans. So here we have 1 ounce blueberry extract improving brain activation in those areas associated with memory and executive function. And then we go into detailed research about these phytochemicals. And in terms of the ADHD treatment, we discussed that it decreases theta waves. These are more powerful antioxidants than vitamin C and vitamin D. And we know oxidative stress is part of ADHD. It can increase the dopamine and norepinephrine. It can maintain the blood-brain barrier. In certain parts of Europe, these are actually prescriptions that are used to kind of for things like hemorrhoids, if we need to strengthen blood vessels. I'm going to talk a little bit about copper, copper and lead for ADHD, but it decreases copper. And remember, we mentioned allergies, and OPCs, support allergies as antihistamines. So these are very powerful phytochemicals. Over the years, I have found what I call mixed OPCs to be most helpful. So you can use grapeseed, red wine, green tea, pycnogenol, curcumin, blueberry. And when we were doing different studies, we just found a combination. And this is the one that we developed for pure encapsulation. You have the most research on pine bark. There's lots of research, and green tea and curcumin. And this is a patented blueberry grape extract from Canada that we use because there was really tremendous amount of research looking at this particular combination of blueberries and grapes with cognitive decline. So I think I have, here's the blend of blueberries and grapes with probably a 10-year history of research. This is just one study. We don't have to go over it, but 2019, using this extract, again, with elderly adults with improved memory. So polyphenols are profoundly important for aging and the neuroinflammation in the aging brain. But what we also have been very acutely aware of over the past 10 years is that most of our psychiatric illnesses, from depression to ADHD, are the result of neuroinflammation. So again, OPCs decrease copper, control catecholamines levels, and improve blood flow. So we've talked about that. So we can come back to that in the questions answered. Now I just want to talk a little bit about really the tragedy in the United States. These are, if you remember, there was a Flint, Michigan crisis where they changed the water supply in a town, and there was lead poisoning for a couple of years until people stopped it. But it kind of created an awareness of lead, which we've known for many, many years. Any amount of lead is toxic and has dramatic contributions to ADHD. You know, since I was in practice, every year or every 5 years, they lower, you know, the amount of lead that people are calling safe. It's pretty clear that there's no amount of lead that is safe. The increase of brain damage is significant, and the odds of getting ADHD is really dramatically much higher. This study said 3 times as high. So the work with lead, I think, is pretty well known. The higher the lead levels, the more likely someone to be diagnosed with ADHD. In the States, we look at lead levels in young children, the pediatricians, but as they get older, for some reason, we stop looking at lead levels. So we've picked up high lead in 7, 9, 10, 12-year-olds, and it is still a problem and needs to be checked. But what I talk more about, because there's not a lot of research, is actually copper. And where I live in Massachusetts, after the Flint, Michigan story came out, people were checking lead in all the water supplies. And in Massachusetts, they did find lead in half the elementary schools and the water fountains, but they also found elevated copper. Now, people didn't really know much what to do about it, but looking at this in children with ADHD for 35 years, I knew this was a significant problem. Elevated copper is common. It is primarily from our copper pipes, but we also see it when zinc and manganese are deficient, then copper can kind of increase. There's copper in the certain medications, birth control pills, smoking. There are many sources of copper, water, pipes being the most common. But copper has profound effects on health, and hyperactivity is one of them. Here you see how we can test for copper. This is a hair mineral test, and it's very easy, and I found it very accurate. We look at, you know, the copper and zinc we're going to talk about in a minute, but if you see here, the copper is kind of off the charts because copper is stored in the tissues. So you're not often going to see serum levels high, but it just gets stored in the tissues, and the hair can predict that. But high copper is a common contributing factor of ADHD. Copper is important, you know, in the synthesis of dopamine and norepinephrine. And if you have elevated copper, you're going to have low zinc. So here's our copper goes up and zinc goes down. So that's the seesaw. Now, most of the ADHD literature for many, many years have only focused on zinc deficiency. And I'll share some of those studies, but I don't know, we have 20 years of research that you can read about that talked about, you know, zinc deficiency and ADHD. And again, we'll go through some of those studies. But what people didn't talk about was what I see as the contributing cause. Because remember, I talked about functional medicine. What is the underlying cause? Not every child, but many kids, it's elevated copper and low zinc. People would just, for years, just assume low zinc. They would give zinc, and many kids got better. but nobody addressed the underlying cause. Nobody looked at the underlying cause. We can pick that up on a trace mineral hair test. But what does a kid with high copper look like? Well, not only are they hyperactive, if you can read my writing, and I don't know what hyperactive in Spanish, but they're aggressive. They have more allergies, but they don't respond to meds. So stimulants. So these are the kids, right, that don't respond to medication. So you give Ritalin, you give Adderall, and somebody gets worse. They get more hyperactive, more irritable. Oftentimes, these are kids with high copper. Why? Because we discussed that it stimulates dopamine and norepinephrine. And so, if these are already high, and you're adding a stimulant, which causes this to go higher, it's very stressful. So the kids that don't respond to these medications oftentimes have high copper. And again, high copper creates the zinc deficiency, so we need to clearly supplement with zinc as well. And these are some of the studies just looking at zinc deficiency. So zinc was lower in ADHD kids. 30% had severe zinc deficiency. And that's moderate, mild zinc deficiency is hard to pick up. Many of the studies around nutritional supplements in ADHD are done outside the United States. There's studies in Russia and Turkey and Iran and Egypt. And this was just one study that in Turkey looked at zinc levels that were normal, and they were given 15 milligrams of zinc. So again, normal zinc, you can't tell a lot by the blood. The hair tests are helpful. They gave a low dose of zinc, so it's not high dose zinc, for just 10 weeks with improvement in these ADHD symptoms. I mean, pretty significant, pretty simple. Zinc supplementation, low dose in kids with normal baseline, improving symptoms of ADHD. And zinc is also critical for dopamine synthesis, as well as serotonin synthesis. But zinc has another unique property, likely why it helps with ADHD. So for those of you who are familiar with this, you have your presynaptic cell, makes dopamine, and that's what supports our ability to focus, pay attention, and motivation. And then dopamine, right? It hits this cell, and here's our positive response. Well, dopamine then gets quickly taken back up into the cell and gets recycled. But zinc kind of acts to bind the dopamine transporter, so it prevents the reuptake. Okay, so zinc prevents the reuptake. So we'll, sorry, let's see. So zinc this do it, yeah, zinc here. So it's going to block the reuptake. So dopamine is going to be able to stay around longer and going to improve attention and focus. Okay, so we had a lot of information about zinc and ADHD going back 30 years. We know it's lower. Anyway, we tested red blood cells, hair, and urine. We know the lower the zinc, the more severe the symptoms. We know we can supplement with zinc and it decreases ADHD symptoms. And we have research looking at zinc added to medications, which enhanced efficacy. And we know as the copper zinc ratios go down, reports get better. Okay, plenty of literature about that. I wanted to just kind of stress this zinc copper balance, and I did mention that the OPCs also, besides enhancing attention, OPCs also decreased copper. So here's this zinc copper balance. The hair test is a very inexpensive test in the States, and it provides lots of information. It provides information on heavy metals, lead, mercury, but what is most often missed is copper, which is easily treated by supplementation with zinc. It's not high dosages. It's 15 or 30 milligrams of zinc twice a day after meals, not on an empty stomach. And then the other mineral I want to talk about goes back a long time, and it's actually 13.8 billion years. This is the Big Bang, right? 13.8 billion years ago, there were three elements: hydrogen, helium, and a little lithium. And what I want to talk to you about is not pharmaceutical lithium, but nutritional lithium for ADHD. The lithium, when the Earth was formed about 4 or 5 billion years ago, settled in the Earth's crust. And these are the lithium salt mines in mostly South America, has very high lithium content. And then what happens is lithium is unevenly distributed across the globe. So I don't know the lithium content in the water in Costa Rica, but it's probably available. But we have been spending many years studying and treating with low-dose lithium. And these variations in concentrations of lithium in the drinking water, okay, in the drinking water, has profound effects on behavior, mood, and including suicide and Alzheimer's risk. So the water that we drink, the tap water, the varying concentrations of lithium has been correlated with suicide risk as well as Alzheimer's risk. And this is extensive research. I'll show you the conference that we're going to have coming up in April on lithium. And again, this is not pharmaceutical lithium. This is not prescription lithium. We're talking about low-dose lithium. And we use it for irritable, aggressive behavior in our ADHD kids. The kids that got kicked out of preschool, the kids that don't respond to medications. And it's probably one of the most significant interventions that I have used in my practice in 35 years is understanding how to use lithium orotate or a low-dose lithium. So we have courses and lots of discussion. The book discusses as well, but I just wanted to bring it up. We also know the best, medication for depression and ADHD is exercise. It works. We know it works. We have good research, and it doesn't have to be, aerobic running. Many of these kids do really well with martial arts. Any kind of exercise has been shown to be helpful. We also know things like mindfulness. We know walks in nature, and certainly parenting has a role in understanding how to treat ADHD. It doesn't cause it, but certainly critical parenting is a major factor in these consequences. I call them the developmental consequences of ADHD, the low self-esteem, the feeling like a failure, constantly feeling like you're disappointing somebody. So parenting does play a role, not in causing ADHD, but on refining and supporting and understanding ADHD to kind of support these kids strengths and really minimizing the weaknesses. So again, we could go on. We have hours of courses and other material, but I just wanted to kind of highlight some of the things, OPCs in particular, understanding high copper, low zinc, and certainly always looking at lead. And so part of what my message is to traditional child psychiatrists and pediatricians is understanding the role of nutrition. This is not alternative medicine. This is a word we used 30, 40 years ago, right? Complementary and alternative medicine. This is just good medicine. If we can, treat high copper in an ADHD child, then that's just good medicine. And again, our difference between functional medicine, looking at the underlying cause, and using that with an integrative medicine approach. And probably the most important thing I can share with you, which is sometimes frustrating because it takes more work as physicians, as clinicians, everybody's different. Every child is different. So we have 10 kids walking in the office, and they all are 12-year-old, they're 12 and they have ADHD, right? Well, child number 1 is going to have high copper. Child number 2 might have low magnesium. Child number 3 might have celiac disease. Child number 4 is going to have lead. Child number 5 might have 3 or 4 of these. And you can see that it is really endless. And rather than guessing, the model that we've kind of articulated, the functional medicine model is testing and trying to look for the underlying cause. Here's the book that we wrote a couple of years ago. Again, it's for parents. And then our Psychiatry Defined, our programs really developed for professionals. And we have this ADHD intensive, which is about 3 months, where we just focus on an integrative approach, for ADHD, based on the model in the Finely Focused book. And that's starting, it's only offered once or twice a year. That's starting next week, actually. No, this week is the first one, but so appreciate we could chat about it. So these are all, we have 70 hours of courses, and then we have a fellowship that's a 2-year kind of mentoring program that you can look at on the website. But we have 70 hours of content and then group supervisions twice a month. And here is some of the content of the fellowship. We're covering all the major psychiatric illnesses. And we have additional courses in testing, adaptogens, mycotoxins. There's a lot. These are depression courses. Some of our faculty, physicians that are comfortable in both integrative and traditional psychiatry. I have not thrown away my prescription pad. And these are some of the conferences. We're having a conference in a few weeks on binge eating, but this is the one I wanted to show you. This is an international conference with speakers who've done the research on lithium and Parkinson's disease, lithium and Alzheimer's, suicide prevention, impulse control, aggression, violence, pretty much traumatic brain injury you see, and cancer. New research looking at lithium deficiency and cancer. So I wanted to leave plenty of time for questions. I'll be happy to answer on any topic of functional psychiatry, or ADHD. You can reach us at these websites. And again, thank you for your time, and really happy to answer questions.
Thank you, Dr. Greenblatt. Very interesting, everything. I just wondering about the OPC. because as you mentioned, we can find OPC in food. So I was thinking, is enough with the food that the amount of OPC, or is better and necessary to supplement it?
I think that I think for our health, for aging, for health, the amount of nutrient dense food with phytochemicals like OPCs are great. But for a child with ADHD, I don't think the amount in the foods would be sufficient to make a real significant change in symptoms.
Okay,
They would need much
perfect.
higher dosages.
So we need to supplement these kids and also adults, because also we can find adults with Hdhd. No,
Yes.
it's the
No,
same.
I just got a lovely note from somebody who, so for adults with ADHD, oftentimes that's all we use. We use an herb called rhodiola
Okay.
and OPCs. Um, and sometimes that really is sufficient and acts almost like a medication in terms of supporting attention and focus. So OPCs probably have a bigger role with adults with ADHD sometimes than with kids.
Okay. And what about gluten? Do you think it's necessary to quit gluten with all these kids?
Well, I think in my um, kind of training, in my world treating ADHD, I don't take anyone who comes in the office and tell a parent to stop gluten. But we have seen three areas, where gluten has been a problem. Um, let me just and so it can be a food allergy, like we discussed, the IgG. It could be celiac, and there's also a breakdown product called gliadorphin. Some kids can't break down gluten completely, and this is a morphine analog. It's really fascinating, and we've seen it a lot. So there is at least three ways some kids could have a problem with gluten, and we can test for these. But I don't necessarily tell every parent with a child with ADHD to just eliminate gluten. I think that that's stressful. There's usually other kids in the home. So I want to kind of test and see if there's something that gluten is contributing to the behavior.
And what about dairy?
Dairy's the same. It's probably the most common food allergy. Um, and you can also have something called casomorphine. So yes, and these are the kids, with sometimes with the allergies, the red ears and the red cheeks. Dairy is often the culprit.
Okay. So we have a question from Catherine, and he's asking if OPC3 for Market America is similarly good product.
Yeah, I used OPC3 years ago. So yes, we've had some success with OPC3. Yes, I have not used that in many years because there's a lot of kind of hype around the whatever it's called, the multi-level marketing, and people were very suspicious of it. But it has been helpful, absolutely.
Okay. And Maria Vasquez is asking if does all this information apply to adults, or is that only affect kids? Yes,
No, it's the same information is applicable for ADHD in adults. Where, as I said, I haven't thrown my prescription pad. A child in school, I might look at the nutritional testing and we improve behavior. But if they have a genetic disposition to ADHD, sometimes we might need medicine for attention and focus. Adults, I use much less medicine and really can utilize this nutritional approach much more successfully.
Okay. So Dr. Arturo Lizano, he said, hello, Dr. Greenblatt, great presentation. Thank you for your time. I know vaccines in children are a very big topic, but in your expertise, will you suggest that there is a connection between the heavy metal content in vaccines and mental health?
Well, I certainly am not going to touch the vaccine issue. I think many of the mercury has been taken out. I certainly think that heavy metals, the lead, the mercury, and the copper, have profound implications for mental health. I don't know enough about what's in the vaccines to say. I do know they took away mercury, but absolutely all the heavy metals affect brain function. It's not being looked at all in our traditional psychiatric circles.
Okay. And Rosemary is asking about what kind and dose of OPC supplement do you recommend for Hdhd kids?
It's hard to recommend doses in these phytochemicals. That's why I, put up the curcumine sorb. But you want at least 50 milligrams of the pine bark. So you can't really put a dose. It really depends on what OPCs you're using. Grapeseed, blueberry, pine bark, green tea. So again, it's hard to use dosages. Most of the research is on pine bark, looking at 50 to 100 milligrams. And then, the rest of these really vary. So you just want to find a product that you use. We actually found, and that's why, that the mixed OPCs are better. You could just take 100 milligrams of grapeseed extract. I don't find that works as well as combination products. So I like combination products, but the dosaging varies based on what's in the supplement.
Okay. So it's better to combine, not to use, for example, only pine bark.
In the EEG studies that I did years ago, we got much better results with combinations. I don't understand it, but we did.
Okay, perfect. And as you know, here there are many with the COVID-19, many people using zinc. So Dr. Jassis is asking if you recommend to stop that copper supplementation in this period.
To stop what?
Stop copper supplementation.
Yeah, I would not be giving copper to anybody unless they have low copper, because there's so much in the environment. So I would only be, there are occasionally we see low copper in depressed individuals, but if someone is measuring copper, I think it's okay to treat it, and I wouldn't necessarily stop it. But I wouldn't be supplementing with copper without someone having a deficiency.
Mm-hmm. Mm-hmm. And can we know what heavy metal test you prefer to test your patients?
Yeah, I've been, again, mostly looking at the hair test as a place to start. And then if we need more testing, we can do it. But I've just been using doctor's data hair test. I think it's called doctor's data. The lithium is so important to the work that I do. Some of the hair tests don't test for lithium. So, the important things that I'm looking for are copper, zinc, magnesium, and mercury. And you want a hair test that does it. So I've just been using this one for 20 years.
Okay. And if when you think the copper is going to go down, no? It's not necessary to think about chelation or something else.
Again, most of the time we see high copper, not low copper.
No, but I mean, if when you use supplements with zinc, that copper is going to go down.
Yes, most of the time. It can take a while. I mean, it can take a year. It can take 3 months. But yes, as you increase zinc, copper will eventually go down. Sometimes, if copper stores very high, then, I also would recommend using OPCs because that binds copper, and vitamin C because that binds copper. So it can be stressful taking copper out. And some kids, after a month of doing well, could get worse because there's a flood of copper coming into the system. But zinc is pretty much over time will kind of balance and help support bringing copper out of the body.
Okay, perfect. And maybe, do you recommend to add NAC, for example?
N-acetylcysteine, absolutely. I mean, there are lots of, things depending, again, we're testing, so we're finding out what else is going on. But certainly N-acetylcysteine supporting glutathione is going to be helpful. There not great studies with NAC and just ADHD, but if we're looking with something like high copper, as you described, with lots of oxidation, then providing supplemental NAC can be helpful.
Okay, perfect. Thank you. There is another question about manganese deficiency. Did you mention manganese deficiency?
That's an important one. So I mentioned magnesium deficiency.
Okay.
So magnesium deficiency is the most common deficiency in ADHD, and it's the first chapter in my book, and it's the only supplement that I tell parents that you can just use on your own. You don't need a test and you don't need to see your doctor, because in my experience, 90% of these kids are deficient in magnesium, and supplementation helps. It helps with sleep, helps with anxiety, it helps with constipation, and irritability. So yes, magnesium is deficient. Manganese, that is typically more in the heavy metal class, and that sometimes we see elevated. And high manganese can also be a contribute to behavior problems. I rarely would see low manganese, but I think the simplest and the most important thing for ADHD, and again, it's the first chapter in the book, and if you were going to learn one thing, I would probably study everything there is on magnesium as the first step in understanding how to treat ADHD.
Okay, perfect. And do you test for genetic SNPs?
Yes, I do. I don't do the tests that look at 1,000 genes. I think it's overwhelming and confusing. But I do look at some genetic testing that help things like MTHFR, the COMT. So I'm using a company in Chicago called Tempest, and they look at 20 genes, focused on psychiatry.
Okay, perfect. And there is a question about B complex. Do you recommend a B complex with high B6 and B12?
Again, everybody's different, and we've certainly, the chapter in the book on vitamin B. So, this folate. Some kids need folate, and absolutely, there's a subset of kids that need B6, and we look at deficiencies of B6 as well. And if someone's deficient, they respond better to B6 than they do to the medications. Okay. Again, not every child with ADHD needs B6. Some do. I believe every child would benefit from the magnesium, though.
Because Dr. Greenblatt, here in Costa Rica, it's very difficult to, I don't know, maybe it's not easy to ask doctors to know the levels of everything, because all the tests, they are very expensive, because we don't have, for example, heavy metal tests here. We need to send all the samples to USA. So sometimes it's very expensive, and the family cannot afford. So we need to sometimes work with the clinic.
Yes, so the B complex, with particularly, that has the higher kind of B6 or B3 are the ones that I recommend. But yes, oftentimes that you can get around some of the testing by looking at, utilizing some of these multivitamins or B complexes. Absolutely.
Okay, perfect. So there is the last question is for an adult who is struggling with his time due to the lack of attention. What will you suggest to do in order to improve his attention?
I think, let's see if I can. As I mentioned, I think that if they're trying to avoid medicine, or you're trying to avoid medicine, then really looking at the OPCs, and rhodiola, the herb. I'd start off low because rhodiola can be agitating, so 100 milligrams, but you could get up to 300 milligrams. That would be the core, and then you want to just make sure the magnesium and the omega-3s. We talked about the B complex, and I think for adults, if you ever did an experiment, that the diet, they'll tend to do better on a low carb diet. So if you can help them, minimize the sugars in the processed food, they will focus better, much better. But
the ratio, excuse me. Okay.
Yeah, the OPCs and the rhodiola, combination can be very helpful. Sorry.
And about omega-3, okay, what do you recommend? More EPA or DHA in these cases?
I think that the research is pretty much all over the place, and I don't think I'm not that convinced it's critical, but we use, slightly higher EPA than DHA.
Okay. Perfect. Okay, thank you. So I think we have more questions, but I think it's enough.
Okay, well, thank you very much.
Thank you, Dr. Greenblatt, and thank you, everybody, because I know it's sometimes hard at this hour. And thank you, really, Dr. Greenblatt. And I'm very happy because I'm going to start the course of ADHD next Thursday, I think, 11.
Oh, are you taking, okay, it's this Thursday.
Yes,
Yeah.
this.
2 days. Oh, good. Okay. You'll be an expert then, and then
Yes.
you can come back and teach. Yeah. Very nice to
Yes.
meet everyone. Thank you very much.
Okay. And thank you. Thank you, everybody. Thank you, doctor.
Okay. Bye-bye.
Bye. Buenas noches a todos. Muchas gracias por participar. Y muchas gracias al doctor Jane Greenblatt por su tiempo y por todas estas enseñanzas que nos ha brindado el día de hoy. Gracias y buenas noches. Good night, everybody. Gracias, doctor.